Good morning, everyone. I'm Shana Varner with PHCA. Thank you for joining us for today's webinar, Alzheimer's and Other Dementias, a Growing Public Health Crisis, an update on facts and figures and Pennsylvania policies. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for all attendees. For those who provided a NAB number, credits will be uploaded within the next 2 weeks. We'll also be sharing certificates with those in attendance. Following today's webinar, you will receive a survey. Your feedback is important to us and our presenters. We hope you'll take a moment after we wrap up to complete that survey. As we begin today, all attendees will be in listen-only mode. Throughout the presentation, please feel free to submit your questions via the chat box on your screen, and we'll make sure to facilitate a Q&A at the end of the presentation. And now I'll turn today's webinar over to Sarah Murphy, Vice President of Programs and Services for the Alzheimer's Association, Greater Pennsylvania Chapter.
Thanks so much, Shana, and thank you so much to the Pennsylvania Healthcare Association, the Alzheimer's Association, both the Greater Pennsylvania Chapter and the Delaware Valley Chapter are represented today, and we very much acknowledge and recognize PHCA for their efforts and our partnership that we partner together to provide and amplify the messages about Alzheimer's and related dementia to your audiences. So I'm excited to be here with each of you today. You have 3 of us representing the Alzheimer's Association that will be doing the presentation. Myself, Shana has already provided you with my introduction, but also we will be dividing the presentation up with my counterpart, Melanie Smith, who's the Director of Care and Support with the Delaware Valley Chapter, and Jen Ebersol, who's the State Government Affairs Director for the state of Pennsylvania. So you will hear throughout the presentation from the 3 of us as we dive into the topic of Alzheimer's and other dementia, a growing public health challenge. So, if those of you who have not aware of us or worked with us before, the mission of the Alzheimer's Association, you'll see there on your screen, but we are really relentless in our work to enhance care and support for people living with the disease and be able to be here to help support the public's understanding of the disease through the life course spectrum. We are the largest voluntary health organization leading in care and support and dedicated to Alzheimer's global research as well. And so each year, and actually every March, the Alzheimer's Association since 2007 has released a report that you'll see here on your screen, the 2022 Alzheimer's Disease Facts and Figure Report. It's become a prominent source that covers a broad spectrum of Alzheimer's issues and reveals the burden of Alzheimer's disease and other dementia on individuals, on caregivers, the government, and a nation's healthcare system. With in-depth look on the national statistics on Alzheimer's disease, prevalence, incidence, mortality, cost of care, and really the impact Alzheimer's disease has on caregiving. There was also a special report that we'll talk very briefly about that really addresses normal aging and understanding that versus mild cognitive impairment. And so you'll see on your screen, just overall, it's a very robust report, and you can really actually download it on our website on alz.org/facts. But really, this is an opportunity for us to be able to provide to you a highlight of what we gleaned from this year's report. And so we know that there's more than 6 million Americans over the age of 65 living with Alzheimer's disease. That's a number expected to increase or double by 2050. We know that the dementia care workforce, including dementia care direct workers, is not keeping pace to meet the demands and the needs that we have in our state. And really wanted to really be very specific here to Pennsylvania and what we know are statistics here. So here in Pennsylvania, there are approximately 401,000 caregivers and over 280,000 living with a diagnosis, and that's over the age of 65. In our workforce, for example, here in Pennsylvania, we have about 273 geriatricians, and we know that that number will need to double by 120% in order to meet the demand of the needs we have in our state by 2050. And with the audience here, we know with about 165,900 home health and personal care aides that we have in the state, we would need to increase that by approximately 26.9% of that number of workers in order to meet the demand that we have by 2028. So we know that the impact is large, the burden is huge, and why we continue to talk about this really as a public health crisis here in our country. And we also, I had mentioned the special report. Each year, the Alzheimer's Disease Facts and Figures report features something that we want to amplify. And this year, we talked a little bit more about understanding mild cognitive impairment, which most of you probably understand that, and including MCI, mild cognitive impairment due to Alzheimer's disease, and really addressing the primary care physician's challenges and being able to give a diagnosis, disclose the diagnosis, the management, and the treatment of the disease. And so this really shows you the graph of nationwide. The number of Americans over the age of 65 living with Alzheimer's really is nearly to double by 2050. So we see from that 6.1 million from 2020 to approximately, if we continue the rate that we're going, to go to 13.8 million by 2050. So the numbers really are staggering and really shows the impact and the burden Alzheimer's disease is having, not only in our country, but really we laid out the numbers here specifically in the state of Pennsylvania. And this really bar graph really shows the impact that Alzheimer's disease is having, or the increased numbers of death. And this is really always very alarming and always something that's really helpful to guide people to show, while other deaths from other major diseases, and it's kind of hard to see here on your screen, but what's outlined here is breast cancer, prostate cancer, heart disease, stroke, HIV, but we're continuing to see the numbers of death from other major diseases remain flat or in fact decrease over the past decade from 2000 to 2019, but we've seen an alarming 145% increase numbers of death from Alzheimer's disease. And so really, as we move forward into this presentation, we're going to talk a little bit more about not just the impact and the statistics of Alzheimer's disease, but now Melanie Smith is going to talk a little bit more about the burden when it comes to specifically caregivers, COVID-19, and the cost of care. I'm now going to turn this over to Melanie.
Thank you so much, Sarah. The costs of healthcare and long-term care for individuals with Alzheimer's or other dementias are substantial. Earlier diagnoses and advancing treatments can help alleviate the future burden. In 2022, the national cost of caring for people living with Alzheimer's and other dementias is projected to reach $321 billion, and this is expected to increase to nearly $1 trillion in 2050. Medicare and Medicaid are expected to cover $206 billion, or 64% of the total health care and long-term care payments for people with Alzheimer's and other dementias. Out-of-pocket costs are representing $81 billion of that, or 25% of total payments. Other costs stemming from private insurance, health management organizations, other managed care organizations, and uncompensated care equate to $34 billion, or 11% of total payments. Several groups of researchers have estimated the health and long-term care cost implications of hypothetical future interventions that either slow the onset of dementia or reduce the symptoms. One analysis assumed a treatment which delayed onset of Alzheimer's by 5 years would be introduced in 2025. It estimated that such a treatment would reduce total health care and long-term care spending for people with Alzheimer's by 33%, including a 44% reduction in out-of-pocket payments in 2050. A second study estimated how much would be saved with treatments that delay the onset of Alzheimer's by 1 to 5 years. For individuals aged 70 and older, the study projected in 2050 there would be a 14% reduction in total healthcare spending for people with Alzheimer's from a 1-year delay, a 27% reduction from a 3-year delay, and a 39% reduction from a 5-year delay. Diagnosis during the mild cognitive impairment stage versus dementia phase of Alzheimer's could also lead to significant savings. The Alzheimer's Association commissioned a study finding approximately $7 trillion could be saved if 88% of individuals who were alive in 2018 and will develop Alzheimer's were diagnosed in the mild cognitive impairment phase. The last 2 decades have marked an increase in the development of new class of medicines to both treat and slow the progression of Alzheimer's. As of February 2022, there are 104 disease-modifying treatments being evaluated in clinical trials or are at various stages of regulatory approval. These potential therapies could also help reduce costs if proven safe and effective. Next slide, please. Looking at the impact of COVID-19, COVID has clearly had a dramatic effect on mortality from Alzheimer's and other dementias, and it has disproportionately affected Americans living with Alzheimer's and other dementias. As data continue to emerge, it is increasingly clear these individuals are more susceptible both to contracting COVID-19 and severe illness due to COVID-19. There were 44,729 more deaths from Alzheimer's disease and other dementias in 2020, compared with averages during the previous 5 years, a 17% increase, as the slide indicates. In 2020 and 2021, 1 in every 10 death certificates listing COVID-19 as the primary cause of death also listed Alzheimer's disease or another dementia as a multiple cause of death. Individuals diagnosed with dementia had the highest rates of hospitalization for COVID-19 among all 21 chronic conditions analyzed, including chronic kidney disease, diabetes, hypertension, and obesity in 2020. It remains unclear whether and how COVID-19 will affect the longer-term trend in mortality and morbidity from Alzheimer's once the pandemic has subsided. Next slide, please. The progression of Alzheimer's is slow and burdensome. During the duration of the illness from diagnosis to death studies, it's indicated that people aged 65 and older survive an average of 4 to 8 years after a diagnosis of Alzheimer's dementia, yet some live as long as 20 years. This reflects the slow, insidious, and uncertain progression of Alzheimer's. A person who lives from age 70 to age 80 with the disease will spend an average of 40% of this time in the severe stage. Much of this time will be spent in a nursing home. At age 80, approximately 75% of people with Alzheimer's dementia live in a nursing home, compared with only 4% of the general population age 80. In all, an estimated 2/3 of those who die of dementia do so in nursing homes, compared with 20% of people with cancer and 28% of people dying from all other conditions. The long duration of illness before death contributes significantly to the public health impact of Alzheimer's disease because much of that time spent is in a state of disability and dependence. Scientists have developed methods to measure and compare the burden of different diseases on a population in a way that takes into account not only the number of people with the condition, but also the number of years of life lost due to that disease and the number of healthy years of life lost by virtue of being in a state of disability. The primary measure of disease burden is called disability adjusted life years, or DALYs, which is the sum of the number of years of life lost due to premature mortality and the number of years lived with disability, totaled across all of these with the disease or injury. These measures indicate that Alzheimer's is a very burdensome disease, not only to the individuals with the disease, but also to their families and informal caregivers, and that the burden of Alzheimer's has increased more dramatically in the United States than the burden of other diseases in recent years. Next slide, please. In 2020, more than 11 million caregivers of people with Alzheimer's disease or other dementias provided an estimated 16 billion hours of unpaid care, a contribution to the nation valued at more than 271 billion. Nearly half of all caregivers who provide help to older adults do so for someone with Alzheimer's or another dementia. And nearly 6 in 10 family caregivers of people with Alzheimer's or other dementias rated the emotional stress of caregiving as high or very high. Evidence suggests the stress of providing dementia care increases caregivers' susceptibility to disease and health complications. 74% of caregivers of people with Alzheimer's or other dementias reported that they were somewhat concerned to very concerned about maintaining their own health since becoming a caregiver. The chronic stress of caregiving may be associated with an increased incidence of hypertension and a number of physiological changes that could increase the risk of developing chronic conditions, including high levels of stress hormones, impaired immune function, slow wound healing, and coronary heart disease. Caring for a spouse with dementia is associated with a 30% increase in depressive symptoms compared with spousal caregivers of partners without dementia. And in 2021, it's estimated dementia caregivers bore nearly twice the average out-of-care costs for non-dementia caregivers, having to cover medical care, personal care, and household expenses for the person with dementia. Next slide, please. Only recently have population-based studies examined racial disparities in caregiving for older people. And these findings are important and they're relevant to the impact of the disease. When compared with white caregivers, Black caregivers are more likely to provide more than 40 hours of care per week and are also more likely to care for someone with dementia. Black caregivers were found to be 69% less likely to use respite services when compared with white caregivers. Hispanic, Black, and Asian American dementia caregivers indicate greater care demands, less outside help or formal service use, and greater depression when compared with white caregivers. Cultural values may also influence gender disparities and perceptions of support among caregivers across diverse racial and ethnic contexts. Black caregivers are more likely than white caregivers to report positive aspects of caregiving. And a meta-analysis found that Black dementia caregivers indicate slightly higher psychological well-being than white dementia caregivers. Hispanic dementia caregivers, however, reported slightly lower physical well-being than white dementia caregivers. And support from family and friends is associated with a better self-rated health for Black dementia caregivers, but not for white or Hispanic caregivers. A more positive perceived relationship between the caregiver and person with dementia was associated with a better self-rated health among Black and white caregivers. Dementia caregiving is clearly common, regardless of race or ethnicity. And these comparisons show that the experience of caregiving may vary. And it's something that we need to pay attention to. Next slide, please. In addition to the main risk factors for the general population, Hispanics and Black African Americans are at higher risk for Alzheimer's. Research shows that older Hispanics are about 1.5 times as likely as older whites to develop Alzheimer's and other dementias, while older African Americans are about twice as likely to develop the disease as compared to older whites. The reason for these differences is not well understood, but researchers believe that higher rates of vascular disease in these groups may also put them at greater risk for developing Alzheimer's. Although these populations are more likely to have Alzheimer's and other dementia, they are less likely to receive a diagnosis than white people, which can limit treatment access, preclude care planning, and worsen health outcomes. A greater awareness of the impact of Alzheimer's and dementia, including the burden of the disease, helps us to understand the lens through which and the approach we're taking as an organization to create change. And with that, I will have Jen present next. Thank you, Jen.
Great, thank you so much, Melanie and Sarah. And, there's been a lot of statistics thrown out there this morning. And, as Melanie indicated, really looking at how we can make and effectuate positive change on this growing public health issue. And so I'd like to start out by saying, really quoting or reading a quote from Dr. David Satcher, who is a former US Surgeon General and former CDC director. You've heard this before about Alzheimer's being a public health issue, but certainly those at the top at the CDC saying the same. that Alzheimer's is the most under-recognized threat to public health in the 21st century. And so I just want to talk through a little bit about, how we're looking at this, how we're trying to change the narrative about how, Pennsylvania and the country addresses Alzheimer's in my presentation, and really talk through about more specifically some of those public policy initiatives that we're working through, both at the state and the federal level. And so as Sarah and Melanie have pointed out, sorry, just trying to get the video here. So as Sarah and Melanie have pointed out, outlined through the association's 2022 Facts and Figures update, Alzheimer's and other dementias is a growing public health challenge that affects millions of Americans in all sectors of our society. And the prevalence and associated costs are dramatically rising and only expected to continue doing so for the foreseeable future. And so while historically people have viewed Alzheimer's and dementia as an aging issue, it clearly is a growing public health issue because the burden is large, the impact is major, but there's also ways that we can intervene. And so while new medical interventions to treat and cure Alzheimer's would lower the trajectory, we also know from successes with HIV/AIDS, heart disease, and cancer that public health has a role to play and can help reverse some of these numbers as well. And I loved that graph that Sarah put up before that really showcased how the deaths from some of those leading causes of death have been actually remaining flat or decreasing, but the deaths from Alzheimer's and dementia have been significantly increasing. So next slide, please. So today we understand that the brain changes associated with Alzheimer's and other dementia takes root many years and even decades before any symptoms appear. And that's why a life course approach to Alzheimer's and other dementias is needed, and why we need public health involvement. After all, public health is actively promoting health at all ages and stages of life and uses population strategies to change outcomes. And so the slide that you see on your screen now shows that throughout the dementia continuum, which is highlighted in purple, the public health community, highlighted in blue, can intervene in a number of ways. They can intervene by promoting health behaviors to reduce risk of cognitive decline, encourage early detection and diagnosis of cognitive impairment and dementia, improve the quality of care for and safety of people impacted by dementia in their communities, and attend to the caregivers' health and well-being. These essential public health activities help reduce burden, they improves health outcomes, and promotes health and well-being among the people living with dementia and their caregivers. And as a result of this, the Alzheimer's Association, both nationally and right here in the Commonwealth, are taking deliberate steps to change the narrative in how we talk about and develop solutions to more effectively and collaboratively combat this disease. One such example is the recent passage of Act 9, a new law that for the first time in Pennsylvania history places Alzheimer's disease and related dementias on par with how the Commonwealth addresses other health issues. Specifically, this new law brings issues related to the detection and diagnosis of Alzheimer's disease and other dementias under the purview of the Pennsylvania Department of Health. And it does two very important things. First, it fosters broader awareness among the general public to understand the early warning signs of cognitive decline and how to have conversations with healthcare providers about any memory concerns they may have. The second thing it does is it ensures the healthcare provider community is up to date on cognitive issues by providing them with educational resources to better understand the value and the benefits of early detection and diagnosis, and includes a toolkit to assist with evidence-based best practices around detection, diagnosis, and care planning. The impact of this new law is significant because it helps to empower families, it ensures the healthcare community is prepared, and more importantly, that the policymakers in Pennsylvania are working in a coordinated, forward-looking way to address this growing public health crisis. So next slide, please. Act 9 is one example of how advancing public policy through advocacy can chart a new course for addressing a serious health issue and reversing stigma associated with the topic. There's a lot of work that must be done to reverse the trajectory of the disease, and the Alzheimer's Association works around the clock to provide essential care, support, and services to everyone impacted. One such way we can significantly reverse these trends is by changing public policy and improving the systems and government structures that support and provide services to this vulnerable population. The Alzheimer's Association is the world's leading Alzheimer's advocacy organization, advocating for critical research, prevention, and care initiatives at the federal, state, and local levels to ensure that families affected by Alzheimer's are not forgotten by our government. Public policy and advocacy is a critical lever to advance our mission and vision at the Alzheimer's Association, because through public policy changes, we can reach the masses of people impacted by dementia today and cement policy changes for future generations. And there's an urgent need for our federal and state lawmakers to act quickly to help slow and reverse the trajectory of this disease. And as you noted earlier, a lot of these numbers, these facts and figures are pretty bleak, and they are only going up. And so it is really important that we all work together so that we can reverse and slow the trajectory of that disease. And that's why the Alzheimer's Association has developed a robust and bold 2022 state and federal public policy agenda to help in doing so. Next slide, please. So right here in PA, our policy and advocacy team works closely with our state elected officials and our governor to have new laws introduced, raise awareness around Alzheimer's, and we provide solutions to the Alzheimer's and dementia-related public policy issues. We've already seen some incredible advancements in last year's public policy priorities, with two of our priorities becoming laws in Pennsylvania. The first was Act 20 of 2021, which made important enhancements to the Pennsylvania Caregiver Support Act that's administered under the Pennsylvania Department of Aging. And the second was Act 9 of 2022, which I already discussed just a little earlier. So we've now turned our focus to making significant policy changes throughout Pennsylvania through legislative and regulatory initiatives to improve the overall government structure and the systems to better support those living with this disease and their families. So first and foremost, our first policy priority issue that we're working toward is that we are working toward ensuring a public health approach to address Alzheimer's and dementia in Pennsylvania. And, you know, I mentioned before, historically, Pennsylvania really views Alzheimer's and dementia as an aging issue, and it's not. And in Pennsylvania, we released our first comprehensive Alzheimer's disease state plan in 2014, and a task force was appointed through the Department of Aging in May of 2018 to lead implementation. And while efforts of the ADRD task force have been laudable, they've been slow moving by the lack of resources to support meaningful work, and efforts are falling short of addressing this growing public health crisis in a coordinated, collaborative, and comprehensive way to improve the state's approach to combat this disease in the same way public health addresses other diseases. So as you heard earlier in the webinar, this growing public health crisis drains physical, emotional, and financial health of all impacted, including state government resources. Different government agencies administer a variety of programs critical to people living with dementia, and these efforts are often siloed, with multiple state agencies working separately from one another. And so the Alzheimer's Association is working to introduce legislation that would significantly accelerate progress in this work by enhancing Pennsylvania's government infrastructure within the Department of Health. Specifically, the legislation we are working to propose would create a permanent ADRD division and establish an ADRD advisory committee in statute, both within the Department of Health, to convene statewide stakeholders on the ADRD state plan implementation. They would coordinate across state agencies, advocate for policy, secure critical federal funding that right now Pennsylvania is missing out on, and leverage additional resources to better respond to the unique and complex needs of those living with Alzheimer's and other dementia and the systems that support them. So this will better position the Commonwealth to work cross-departmentally to grow and capitalize on public-private solutions to address this rapidly evolving public health issue. And to support this work, we are advocating for an annual $500,000 state appropriation to support this legislative proposal. The second issue that we are really working towards in Pennsylvania is to ensure that Pennsylvania is equipped with a dementia-capable workforce. So we are building awareness and capacity, especially in light of the impact COVID-19 is having on those living with Alzheimer's and dementia, as Melanie so clearly lined out, around the need for more standardized, competency-based dementia training across the long-term services and supports continuum. This includes competency-based training for all direct care staff and administrators in nursing homes, personal care homes, and assisted living facilities, and those providing home and community-based services. In addition, we continue to look for opportunities to standardize dementia training curriculum for adult protective services for service workers and other first responders who often are the people to interact with those living with the disease when an emergency arises. So we're evaluating where we have opportunities to influence change in these areas and are engaging in legislative, regulatory, and departmental policy changes as they arise. Specifically, we've been weighing in on the Department of Health's proposed nursing home regulatory packages. For the first package, we urged the department to include systematic changes to direct care staffing across the spectrum of recruitment through retention to better support this critical workforce, and that the level of care for each resident is determined based on need and acuity as outlined in their care plan. And throughout all three regulatory packages to date, we've encouraged the department to consider the principles and facts outlined in the Alzheimer's Association dementia care practice recommendations related to dementia care, and consideration of the following: that staffing levels should be adequate to allow for proper care at all times, day and night. Staff should be sufficiently trained in all aspects of care, including dementia care. Staff should be adequately compensated for their valuable work. Staff should work in a supportive atmosphere that appreciates their contributions to overall quality care, because improved working environments will result in reduced turnover in all care settings. Staff should have the opportunity for career growth, and they should work with resident families. We also noted that maintaining consistent staff assignments to a resident is an important component of quality care for staff working with residents with dementia. So looking forward to the fourth and final package of nursing home regulations, we anticipate weighing in more heavily on each of the components that I just outlined. And our last state policy priority that we're working toward right here in Pennsylvania is to continue to protect residents in long-term care settings from COVID-19. And we know, as each of you are unfortunately acutely aware, long-term care residents, their families, and staff have been in crisis since the beginning of the COVID-19 pandemic. And for those living with Alzheimer's disease or other dementia, maintaining a daily routine and receiving person-centered care is paramount to their overall cognitive, physical, and behavioral health. This is especially important considering that nearly half of all long-term care residents are living with Alzheimer's disease or other dementia. And so we will continue working with state leaders to evaluate legislation, regulations, and other public policies to ensure people living with dementia have access to high quality, person-centered care, while ensuring appropriate prevention and mitigation strategies remain in place to allow for safe visitation. Again, we've been weighing in on the Department of Health's proposed nursing home regulatory package with an eye on infection control and prevention. Even now, as we are seemingly coming out of the current pandemic, it's important that we learn from the lessons taught to us by COVID-19 and ensure stringent measures are built in the future for a strong response to any future pandemic-related illnesses that would require infection prevention and control practices. And so we'll continue to look for other opportunities to encourage patient-centered quality care while protecting residents and staff from future variants of COVID-19. Next slide. So I know that was a lot of ground covered, discussing a lot of our public policy work at the state level, but I'd like to now take a few minutes to shift gears and discuss what the Alzheimer's Association is focusing on at the federal level. And first and foremost, we are advocating support for the Comprehensive Care for Alzheimer's Act. And comprehensive dementia care has been shown to reduce costs while providing better quality of care. Unfortunately, dementia care management programs have not developed within the current Medicare fee-for-service system. And so the Bipartisan Comprehensive Care for Alzheimer's Act would ask the Center for Medicare and Medicaid Innovation to test a different payment structure for dementia care management. And so this important legislation has the potential to streamline today's complicated healthcare maze for people living with dementia and their caregivers. The second policy issue we are working to enact at the federal level is the Equity in Neuroscience and Alzheimer's Clinical Trials Act, or the ENACT Act. I know that's a big mouthful, but Alzheimer's and other dementia, as Melanie outlined, disproportionately affect older Black and Hispanic Americans compared to older whites. And as she pointed out, Black Americans are twice as likely to develop Alzheimer's, and Hispanic Americans are 1.5 times more likely to develop the disease. Even so, much of the Alzheimer's research to date has not included sufficient numbers of Black, Hispanic, Asian, or Native Americans to be representative of the US population. The underrepresentation of these populations not only hinders the ability of researchers to understand these health disparities, but it also restricts their knowledge of how an approved therapy or diagnostic may affect the populations most likely to need this treatment. And so the Bipartisan ENACT Act would increase the participation of underrepresented populations in Alzheimer's and other dementias clinical trials by expanding education and outreach to these populations, encouraging the diversity of clinical trial staff, and reducing participation burden. Then we move to our appropriations requests at the federal level. And while significant progress has been made to increase funding for Alzheimer's research at the NIH, current funding levels for Alzheimer's research continue to fall short of the total funding scientists and the U.S. Advisory Council on Alzheimer's Research, Care, and Services believe is needed to meet the goal of finding a treatment or cure for Alzheimer's and other dementias by 2025. And so we're asking Congress to continue its commitment to the fight against Alzheimer's and other dementias by increasing funding for Alzheimer's research by an additional $226 million in fiscal year 2023. In addition to NIH funding for Alzheimer's research, we are asking Congress to fully fund the BOLD Infrastructure for Alzheimer's Act, the Building Our Largest Dementia Infrastructure for Alzheimer's Act, at $30 million authorized in law for CDC in fiscal year 2023. This funding specifically will strengthen the public health infrastructure across the country by implementing effective Alzheimer's interventions, such as increasing early detection and diagnosis, reducing risk, and preventing avoidable hospitalizations. And the last issue that we're working at the federal level is around support for the Alzheimer's Caregiver Support Act. As we mentioned before, an estimated 11 million Americans, 401,000 Pennsylvanians are providing unpaid care to someone living with dementia, and they need more support. So while providing this assistance can be rewarding, it's also quite challenging for the caregiver to sustain. So the Bipartisan Alzheimer's Caregiver Support Act would provide much needed relief for our nation's caregivers by providing grants to states to allow for providing more educational and support opportunities for those providing unpaid care for their loved ones. Next slide, please. So the Alzheimer's Association, as I outlined, has had a successful track record in moving public policy forward. And it truly is because of our volunteer advocates amplifying the voice of Alzheimer's and all dementias. It's our advocates who are sharing their stories. They're sharing how they're impacted. They're sharing about how the impact of dementia and caregiving for a loved one with dementia is impacting their businesses and the economy that we live in. And it's only through them sharing their stories that our lawmakers, both at the state and the federal level, can fully understand the breadth that this disease impacts everyone in our communities. And so our advocates are truly the heart of our public policy operation, and it's because of them that the Alzheimer's Association is the leading voice for dementia advocacy, speaking up for the needs and the rights of all of those affected. But we still have such a long way to go, and we're always finding opportunities to engage passionate Pennsylvanians in the fight against Alzheimer's. And so if anyone joining the webinar today is interested in learning more about our public policy priorities or becoming part of the movement that is helping to change Alzheimer's and all dementia public policy on Capitol Hill in Washington, D.C. and in Harrisburg, I encourage you to please visit www.alzimpact.org for more information, or certainly feel free to reach out to me directly. I would love to talk with you more about some of our public policy efforts and how we can work together to change the future ahead. And so next slide, please. And so I do want to just close out by saying, last but certainly not least, please know the Alzheimer's Association, we are available to assist anyone around the clock, 365 days a year through our 24/7 helpline, and that's 800-272-3900. Through this free service, specialists and master's level clinicians offer confidential support and information to people living with the disease, caregivers, families, and the public. You can contact the helpline day or night to speak confidentially with care consultants for decision-making support, crisis assistance, and education on issues families face every day. You can learn about the symptoms of Alzheimer's and other dementias. Find out about local programs and services. Get general information about legal, financial, and care decisions, as well as treatment options for managing symptoms. And receive help in your preferred language through our bilingual staff or translation service, which accommodates more than 200 languages. You can also access support through our TTY service if assistance is required via a teletype device. And so as you can see, we're here to support anyone, and we encourage you to share information about the Alzheimer's Association and certainly our 24/7 helpline. And so with that, I'm going to close out our webinar today, and we do have about 15 minutes left. I'm going to ask that Melanie and Sarah come back on screen, and we'd be happy to answer any questions that anyone participating today may have.
Jen, Sarah, Melanie, thank you guys so much for today's presentation. Just as a reminder, we're going to go ahead and open things up for our Q&A. Go ahead and submit your questions using the chat box in the GoToWebinar pane. At this point, it doesn't look like we have any questions that have come through, but Sarah, Melanie, Jen, I want to open it up to you guys. Is there any information from a provider standpoint that might be helpful? I know a lot of these are for caregivers, and I know that's so important, especially as providers are looking to connect their resident family members with services to help them and support them. Anything that you'd like to make sure our providers keep in mind as they're providing support to these residents and their family members as well?
Yeah, can you hear me okay? I'm not sure if I just stopped sharing my screen, so I don't know what's going on. Can you hear me?
Yes, we can hear you.
Okay, good. Yeah, I mean, we didn't touch on, we do have, if there is, we do have dementia care best practice recommendations through the Alzheimer's Association, where we really address that person-centered approach and focus for care, for quality care. For anyone with a diagnosis of Alzheimer's disease, vascular dementia, Parkinson's dementia, or whatnot. And so we do have those 56 recommendations outlined back in 2018 in the Gerontologist. Not that everyone sits there and reads that publication, but this really was the cornerstone or foundation the Alzheimer's Association really wants to amplify on how best to approach dementia care. And so, I would say that if you as providers are not aware of what those look like, feel free, we certainly can provide that link. But if you go to our website, we have our dementia care best practice recommendations outlined there, and really just, being able to have that person-centered approach and focus. Obviously, what you do for one person, the care is going to be different for another person, because everyone is very different in their own unique strengths and personalities. So that's something that just would emphasize that for those of you who are not aware, that is something that we do have and offer. So, and I don't know, Melanie or Jen, if you have anything else to add to that, feel free to.
So I did drop a link to the dementia care practice recommendations in the chat for anyone to access.
Thanks, Jen.
Wonderful. Well, I just want to again thank you to our presenters today for sharing this important presentation and important information, and thank you to all of our attendees for taking time out of your busy morning to join us. As a reminder, there will be a survey that is shared with all of you following today's webinar. Your feedback is important to us and our presenters. We hope you'll take a minute to complete that survey. As always, if you have any questions, please don't hesitate to reach out to us here at PHCA. Our team would be happy to help in any way we can. And have a great day, everyone. Thank you so much.